Good afternoon, Nico Heidfield. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Hello, Mihiraa. I understand you're feeling quite uncomfortable right now with your painful foot. I've just had a quick look at your foot, and I can definitely see the ulcer on your foot. I noticed that the area around it looks quite red. It feels warm to the touch, and there's some swelling. I also see a bit of discharge and can smell a mild odor, which often happens when an ulcer is getting worse. Mihiraa, my job now is to get a little more detail about what's been happening so we can figure out the best way to help you quickly. Now, apart from the changes to the ulcer itself, what other symptoms have you been experiencing recently?
Oh, nurse, thank you. The pain has been getting much worse, almost unbearable sometimes. It's a throbbing pain, especially at night. I haven't had a proper fever, but I do feel quite chilly in the evening sometimes, even under blankets. The redness seems to have crept up a little bit over the last couple of days. No numbness, thankfully.
I appreciate you sharing that, Mihiraa. It sounds like the worsening pain and spreading redness are very worrying. Before you came in today, you tried treating the ulcer at all? I mean, have you been cleaning it, putting on any dressings, or using any antiseptic creams?
Well, I've been trying to keep it covered with a dressing and washing it gently with soapy water, but I haven't used any special antiseptic creams. I've been taking a couple of pain relief tablets from the chemist a few times a day, but they don't seem to touch the really bad pain anymore.
Also, to help the doctor later, could you tell me a little bit about your medical history? Have you had any similar ulcers or wounds on your feet or legs before? It's important for us to know if you have diabetes or if you smoke, as these things can affect how quickly wounds heal.
Yes, I did have a small sore on my other foot a couple of years ago that took a long time to heal. And yes, I was diagnosed with type 2 diabetes about 10 years ago, but I mostly manage it through diet. I don't smoke, though.
Thank you, Mihiraa. Knowing about your diabetes is very helpful, as it means we need to take extra care with your feet. Based on what I've seen and what you've told me, here is the likely treatment plan we will start with. First, we will properly clean the wound to remove any dirt or discharge, and then we'll put on a special appropriate dressing that helps the wound heal and keeps it protected. Because the ulcer looks quite red and is discharging, it's very likely that you'll need antibiotics to treat any infection. We will also give you stronger pain relief here to make you more comfortable. The next steps will be, a doctor will come to examine your foot more thoroughly. They will likely order some blood tests to check for signs of infection in your body and a swab culture. That's where we gently wipe the wound to find out exactly what kind of bacteria is causing the infection. Depending on what the doctor sees, they might also order an X-ray to check if the infection has spread to the bone underneath.
That sounds like a good plan, nurse. I'm relieved to hear I'll get some proper pain relief. I suppose the antibiotics are important too. Well, do I need to be hospitalized?
Mihiraa, they certainly are important. Now, I do need to stress that sometimes when an infection is serious, we may need to keep you here, which is called hospital admission. This may be necessary if the infection is severe, if the redness keeps spreading quickly, if you develop systemic symptoms like a high fever and feeling very unwell, or if the doctor suspects the bone is involved. We would also admit you if the ulcer is so bad that you cannot walk or put weight on the foot. Do you have any concerns or questions about any of this so far?
I see. My main concern is just getting rid of this pain and making sure my foot is okay. I'm also worried about how long I might have to stay off my feet if I do get admitted.
That is completely understandable, Mihiraa. Your concerns about the pain and your worry about having to stay off your feet are perfectly valid, and I want to put your mind at ease as much as I can right now. Regarding your stay and the need to rest your foot, I can assure you of this. You won't be discharged from the hospital until the doctor has had a proper, thorough look at the ulcer, and we are completely confident that the infection risk has been fully evaluated and is under control. We would never send you home if we thought the infection could get worse. While you are here, whether just for a few hours or if you need to be admitted, you can expect us to provide the appropriate treatment that is tailored exactly to your ulcer's needs. Mihiraa, this means continuing with the specific wound care and antibiotics we discussed. Crucially, we will make sure you keep the weight off that foot as much as possible, as this is the most important step for letting the wound rest and heal. Before you leave us, we will also make sure you have a very clear follow-up plan in place, so you know exactly who to see and when for continued care. I promise you that I will make sure the doctor comes to see you as soon as possible to begin this entire process and answer any other questions you may have.
That's a relief. I'm glad the pain will be managed soon. I'm ready for the doctor whenever they can see me.
Mihiraa, before we conclude, let me quickly summarize everything we've discussed. We confirmed you have a painful foot ulcer with signs of infection, like redness and discharge. You mentioned you are also feeling chilly, and the redness is spreading. You also share that you have diabetes, which we need to be very careful with. The plan is to clean the wound, apply a special dressing, give you pain relief, and likely start antibiotics. You will then be seen by a doctor who may order blood tests, a swab culture, and possibly an X-ray. We also talked about the possibility of hospital admission if the infection is serious. Rest assured, we will manage your pain and ensure your
Thank you, Nurse Nico.